Mr. President, I oppose the confirmation of California Attorney General Becerra to be the Secretary of Health and Human Services. Our future HHS Secretary will be at the helm of rebuilding our country toward normalcy and preparing to address the weaknesses in our healthcare infrastructure brought to light by the pandemic. It will be no small task, and its handling will have an impact on America for years to come. It will require a leader at HHS who has the trust of the public and the requisite healthcare experience. Unfortunately, those two factors are missing from the nomination of Attorney General Becerra. In recovering from a once-in-a-century public health emergency, Americans need to have the confidence of our HHS Secretary understands the intricacies of healthcare policy and has an eye to the future as we improve upon our pre-pandemic vulnerabilities, protecting future generations from experiencing similar pandemic situations. While Attorney General Becerra served on a healthcare-focused subcommittee as a United States representative, he has no further experience in public health or medicine. He also lacks the executive experience that would be useful in running a complex executive branch department like HHS, which is involved in the nationwide vaccine rollout and now the regulatory implementation of the recent $1.9 trillion package. The American people need to trust that their HHS secretary will work for them, regardless of disagreements over ideology. Like a president, cabinet officials work for the entire country, and broad public trust is essential. As Attorney General Becerra was serving his current role in California as Attorney General, the Trump administration was making significant regulatory changes to protect the sanctity of life. Attorney General Becerra then spent much of his time attempting to overturn or ignore those changes. Most recently, Attorney General Becerra actively defended a California law requiring abortion coverage in insurance plans covered by churches. The Office of Civil Rights at HHS ruled on January 24, 2020, the state's abortion mandate violated federal law, but Attorney General Becerra refused to comply. Ideological or moral disagreements should not be met with legal challenges. Americans need to know their government is working to find a common ground that will protect all strongly held personal and religious beliefs, including the belief in the sanctity of life. Thoughtful healthcare policy matters to Kansans and Americans now more than ever. We need a leader at HHS who is eager to serve all of the country, even in the face of disagreements, one who has the necessary healthcare expertise to be successful in this position and will be an asset to our country in this time of rebuilding. I oppose this confirmation and urge my colleagues to join me.